speaking with Gina Calderone. How are you, Gina?
I'm great. Thank you. Thanks for having me back.
Absolutely. It's been such a great honor to have you join the conversation again. And like I told you off air, it's like you never left.
Well, let's pick up where we left off.
Wonderful. Well, Gina, how about let's start with you having us tell us about, what inspired you to launch your business and become a holistic physical therapist?
I started in traditional physical therapy, and I was seeing about 26 patients a day. I had about 15 minutes with each patient, and I just didn't feel like I was getting anywhere with their healing. It was so quick, and I noticed that I thought people wanted to say more of their story, and so I started my own practice, and I essentially had more time with my patients and got to know them better, got to understand their stories. And it seemed as though when I started to work with them, they were able to share deeper parts of themselves and life experiences and explain the relationships and troubles that they had had or anything along the way in their lives that had caused any type of negative feeling or experience inside their bodies. And so I was able to start to tap into that. And I kind of started from there, and then each person that came through the door had pain and chronic pain and disease and illness and addiction, and it's just kind of rolled into what it is today. Absolutely.
You notice how one energy will actually gravitate to the other. It reminds me that in life we are vibration, frequency, and energy. That's really what it is all about, right?
Absolutely. And it's just been listening to people's stories, and I care about people. I wanted to understand who they were and what happened in their lives, and connected those dots inside their body, and they felt better and they felt like they could breathe again. And that was the greatest thing. So I knew I was onto something. So I kept going.
Beautiful. Well, I really want to acknowledge you for continuing with your mission in terms of how you can be of better service to others. And with that, what's coming through for me, Gina, is, for the listeners out there, I myself, I tend to question around, well, what differentiates you between being a holistic, right? A holistic, energetic physical therapist with, let's just say, for example, someone working in the medical field as a physical therapist?
Yeah, I noticed that people that came to the studio, some had just come from physical therapy. So it occurred to me, what didn't happen there and why are they coming here? So I obviously had to do something different. And so there's different bodies to treat. There's the physical body, but there's also what I know now is the emotional and energetic body. And we have to acknowledge these emotions and connect them to the physical. If we just work on the physical, we aren't getting to those deeper layers. And so that's what I offer. And it seems to really help people find peace inside their body and release that inflammation or trauma that's been holding inside.
The trauma that has been holding inside. And I realize as you're sharing what's coming through for me is we live in a society where we repress so much, right? And it's through that repression that resides in the solar plexus, which is the stomach area, where we repress so much, and then we become the only co-creators of our own illness, right?
That's right. I think it's important that stomach solar plexus area that you're talking about is our identity. It's who we are. And if we don't know who we are, we haven't been allowed to be who we are, that can hold inside, and it doesn't express, you don't get to express who you are, and that's being held deep down inside, and it begins, what I see now is manifest into lots of different problems, and it's confusing. People get lost, and their spirit, starts to dampen, and they become sad. And then so when they come in, their bodies are also like that rounded shoulders, back is curved, and they feel heavy inside their bodies. And so what I'm trying to do is reverse that and find a lightness again and reconnect back to their spirit.
Connecting back to the spirit. Yeah. I hear you with that in terms of how you're able to support, the people that meet with you and hold that sacred space. Now, I personally joined your retreat Uprising a few months ago, and it was fabulous. So I personally have my own experience around my own personal breakthrough and how you've been able to support my own, individuation is what I call. Yeah. I would love to, shed some light around, when you talk about our body store generational trauma in the soft tissues and organs. Now, I know that during that retreat and last week we, touched a little bit into it around the six primary bullet points, so to speak. So why don't we start with the first one? Does that work with you?
Sure.
Wonderful. Yeah. So I know the first one is uncover the emotional roots of unfinished family business in your body.
Yes. We want to uncover those roots. If anger is a core emotion in your family, we want to understand underneath that, what that's going to look like physically is inflammation. So inflammation can just start as tightness in the body, and we wouldn't necessarily diagnose that. We just kind of say we have tight shoulders or a tight neck or a tight back. And if it stays there long enough, then inflammation can start to cause systemic problems. So maybe what we need to look at is, why are we so angry? Or what are we angry about? Or maybe I'm holding my anger because my mother or father, they might be too afraid to express it themselves, so the child holds on to it. And they're really mirroring it for the parent. So it's important that we uncover these emotions.
Mirroring it for the parent, absolutely. And as you were sharing, I heard Tony over here next to us breathing, and it seemed to me energetically that it was resonating. Is there anything, Tony, that you would like to ask our guest?
No, I'm just laughing because, yes, of course, it did resonate. Of course, my father was a very angry, violent man, and so, yeah, that certainly resonates with me. But what I'm curious about, though, is the idea that this energy is stored in the soft tissue. How do we know this? How can we verify or let the audience know that this is actually happening for human beings' bodies?
Well, we know there's research out there that shows that emotions store inside the fascia, which is like this sheath that's around the muscles. So when we get a massage or anything like that, if we're paying attention to it, things can come up in our lives. We may come out of the massage. And a lot of this, I think, has to do, though, with the practitioner as well, if they are holding that space for you to heal something. If you're just getting a massage and the intention with the massage therapist is just relaxation, then that's maybe what will come out of that. But if the intention with what I usually hold for people is, I want these emotions to come up, I want them to move through the body so that they can actually heal them. And I think that that's really important, but it holds in this tissue. And so it's actually pretty simple to go in there and work with the tissue, loosen it up, reconnect it, get it strong, and get the muscles efficiently working so that we feel good inside of our bodies instead of tired or tight, sore, anything like that. Like, these are just like these precursor kinds of symptoms that we can be physical therapists can be this front line of defense. Like, let's stop this now before it turns into something. Those are our signals.
Absolutely. And speaking of the front line of defense, right, as that guide to your clients, when we talk about the body and how our body protects us from, fill in the blanks, the next bullet point is surface traumas and secrets that your body is protecting.
Right. If anything has happened in your body that maybe you are or are not aware of, that's happened in your life, I should say, will deposit inside of our body and it will hold. And so what I've seen is a trauma posture. It's where the head moves forward, the rib cage slides back as a rounded curve, the tail tucks under. It's just like what a dog would do if they're afraid. They just tuck and hold on to everything deep inside of there until we're ready to open it, or pain is usually what people come in with. And so I have to open the body with pain, but I'm kind of opening it with a sensitivity to them, and holding that space for them to share if need be, or just to open as they feel comfortable with it, but to reverse that trauma posture.
To reverse that trauma posture. Now, I love the metaphor of the dog that you mentioned, because how much more transparent can we get, right, than a dog?
Right.
And with that being said, our bodies responds to our feelings.
That's right.
And so the metaphor of the dog really stayed with me. Now, the third one is tune into your body's GPS signal of pain to lift invisible wounds. What's the GPS signal?
The GPS signal is our emotional pain chart that I have. It's there's one on the website. You can look at it, and it's like we can look at the different emotions that sit inside of our physical body. So if our spine represents support, our shoulders can carry the burdens of our lives or of the world. Our hips represent moving forward. Our knees are about bending and not being so hard-headed with things. Our neck, we need to turn and look at all situations. We can be stubborn with those kinds of things. So we do have an emotional body chart that we can look at and give us some insight into where our body is currently in a state of pain. So that can help us.
That can help us. And when our body's in a state of pain, what's coming through is the patterns, which is taking us to the next one, is ending repeating patterns of trauma in your body, life, and family.
Yes. We are a nation in pain right now. We have so much pain. The opioid epidemic, we can see that people are taking so much medication for this pain. And so the generation right now has a big responsibility of stopping it and looking at these emotions and feelings. And I think they are feeling, and that's why we have depression and anxiety so high right now. And this younger generation that I see coming into my studio, and it's weighing on them. So as parents and grandparents, if we can start to talk and tell our stories, I believe we can lift some of the weight off of their bodies and their souls.
Lift the weight off. As you were sharing that, I just could feel like a vibrational release, and I absolutely love that feeling. And speaking of healing, as we continue, number 5, healing the broken-hearted wounds, driving generational addiction, pain, and disease.
Yes, broken hearts, it could start so young. If we lose a parent, if neglect, if a mom or dad leaves the house, if a parent is incarcerated, any kind of separation, it can leave a broken heart on a child, and they miss that their whole lives, and it can, that pain can weigh so heavily in the chest that at a certain point we want to numb it instead of feel it. So it can begin to live a life that looks like a path of addiction, and we want to heal those broken hearts.
Numbing, it traces back into the repression, right?
Yep.
Well, we repress those feelings and we numb them and we try to avoid them.
Right.
But the more we avoid them, the more they come back in triple.
Right.
And we want
to teach young kids how to feel and what to do about those emotions so that they feel empowered and live successful lives.
Feeling empowered, and how much better than to start with the younger generation, right?
That's great.
Not that we're a lost cause.
No.
We can become woke, and everybody has their own curriculum. So I acknowledge you for also mentioning, too, though, the younger generation and how we can support them as parents, as mentors.
I think we can change PE. We can look at specific exercises that can help the brain feel more connected to the body and help them feel more empowered inside of themselves instead of the different kinds of side effects that can happen from trauma that affect the body, and kids look confused, they look agitated, they look like they're hypersensitive, lots of different symptoms that can actually, they can get a hold of by using the physical body as a vehicle to heal.
Using the physical body as a vehicle to heal. Absolutely. I'm a yes for that. And now, last but not least, in your wounds are your greatest gifts, your life's purpose and passion. Ooh, I like that.
I know that
there's always light at the end of the tunnel.
There is light at the end of the tunnel. Underneath your wounds lies your greatest gifts. If you have a story that you need to share with anybody or just get it out of your body, I can guarantee you under that wound you will find the power that will heal you, and you will find your purpose and your passion in life. It will begin to flow more than you could ever imagine.
Wow. Well, in less than 1 minute, elaborate a little further on that passion and how can we expand around that energy?
The passion, I think you can begin to connect into who you are and that your identity, and begin to have the courage to pursue a path that is a dream and something that you've always wanted in your life. And when you open up these shadows and these dark wounds, there's this magic underneath there, and you'll begin to see it blossom.
Beautiful. You will begin to blossom. Well, you're listening to Transforming Consciousness. I am Vanessa Valdez on 90.7 KPFK and KPFK.org. And for those listening from your smartphone's Pacifica Radio app, we are discussing how to heal from generational wounds in the body. Our special guest is Gina Calderone, physical and energetic therapist, offering 3 sessions and only 3 sessions to the first 3 callers. It is a limited package. We also have Janine Bernstein, author of the book Get the Funk Out, who very shortly will be joining us to share more about what that entails. So continue to stay tuned. The number to call and make your pledge is 818-985-5735. Once again, 818-985-5735.
And we do need folks to pledge on a credit card because this is a limited item. We need you to use an American Express, Visa, Discover card, or MasterCard. But I've begun to feel, Gina, like this segment is specifically for me. I mean, I'm sitting over here resonating with everything. But the question that I really want to ask you before we go further into asking folks to call is, what are some of the success stories you've seen from your clients? Without mentioning names, what have you seen transform gigantically for people from your work?
In just a short period of time with someone who was recently diagnosed with OCD, he had told me that he was able to tell me a story about sexual abuse that he had endured, and we were able to he was able to tell me the story right away, which was a huge success. And we were able to go right into treatment, open up the body, reverse that trauma posture, open up the heart, open up the pelvis, and begin to release a lot of these toxic emotions that have been stuck inside, and then reconnect him to his breath and back into the core of his body. And when he left there, we had said bye, and he ran back in and he said, "I can breathe again."
Wow.
And I was like, wow, that's really amazing. And so, I'm just an observer to these people, but I see that in their stories that they share, sometimes it takes a while, but it seems like now that the pain is it's in a pressure cooker, and when they come in, they're ready. So I'm ready. And from there, I'm able to hear these stories and move this pain quickly through the body, and see great success.
Well, the other thing that strikes me is, first of all, you're clearly an actual healer, which is why you left the medical profession to be a healer. That's obvious. It's the reason I would choose you. One of the reasons I would choose you. I'm in the room. I can feel your energy, so I would choose you either way. However, I want to say this to people. That is the important moment here, is that this is a healer who chose to leave the medical work she was doing because she wasn't healing people. This is a legitimate person, folks, with the ability to move this, and that is why this unique item is available in a limited way. The other thing for me is this. There's been a post on Facebook that has said the gateway drug is trauma. Mm-hmm. And I believe that's exactly what you're describing. People that have addictions, people who are on opioids, people who use marijuana every day, people who use alcohol. These addictions are often based in trauma that we haven't dealt with from our childhood, and this sounds like a fantastic way to begin to release that.